Hey, TikTok universe. You've heard of high blood pressure being the silent killer. Well, how about this? I've got one that's even more of a silent killer, and that would be medications used for GERD. So based on actuarial tables and life expectancy, you can expect that untreated blood pressure will reduce your lifespan by about 18 months maybe. But long-term treatment with proton pump inhibitors, so think of Nexium, Prilosec, and Prevacid, tends to reduce your lifespan by about 2 years. They're only supposed to be used for a short period of time. They do reduce stomach acid, so a lot of people on non-steroidal anti-inflammatory drugs are placed on PPIs. The reason they reduce your lifespan comes from Washington University in 2017, so kind of in my backyard. Increased risk of heart disease, dementia, kidney problems, and fractures. The heart disease risk is related to the fact that proton pump inhibitors inhibit nitric oxide synthesis, which is important for arterial dilation and reduction in blood pressure. It's made in the endothelial cells lining the arteries. And so if you block that production, it damages the endothelial cells. So you've been told hypertension needs to be treated because it's going to kill you. And proton pump inhibitors are used by about 50 million Americans. High blood pressure is present in about 45% of Americans, almost half. A better option would be the old-time histamine receptor blockers. So think Tagamet, and think Pepcid, and think Zantac, which are now over the counter, as are most of the proton pump inhibitors. But the PPIs are actually much more dangerous than you've been led to believe. So 2-year reduction in your lifespan for prolonged use of proton pump inhibitors versus because of nitric oxide desynthesis or lack of synthesis, whereas the old-time cimetidine, Zantac, ranitidine, and all that do not seem to do that. So I'm reading about life insurance actuarial tables, and I'll come back and talk to you about some other things that reduce your lifespan much more seriously than high blood pressure. So have a great day, and I'll be back soon. Talk to you later. Bye.